develop a high risk. From that, we develop a high risk contact list, and we contact all of those individuals to let them know that they've been in contact with a positive case, and they have to self-isolate for 14 days in a home. Other individuals who are in contact with the case who are considered low risk, we send them a letter saying that you were exposed to a case, but you're low risk. You just have to self-monitor for symptoms. If you become symptomatic, please get tested. So the high-risk contacts and the case have to self-isolate for 14 days. If the case worked at a particular workplace, we will send out that low-risk letter through the employer. We ask that they send it out to all the staff, and the high-risk one to the list of people who are considered a high risk. We'll follow up with another letter to the high-risk people after the interview, just to make sure that that we have a customized letter for that person. And then we check in, I think, day 1, 5, and 7, or throughout the isolation period to see how the person's doing. Are the symptoms getting worse? Do they need to go to the hospital? That sort of thing. We also deal with other aspects of their isolation, their living conditions, how many people they live with, whether the landlord is not happy that they're a case. All those things come into play, and we're there to support the case and the contacts to get through the isolation period. A workplace outbreak is when we determine that there's been transmission within the workplace, and we have 2 cases that are linked together. So we don't declare those unless we determine that. And that's a call that usually our medical officer of health makes.
Okay, fair. One question now, are businesses allowed to refuse service for those who are traveling for leisure?
So this came up quite often last week. We reached out to our legal counsel, and their opinion is that a business owner in trying to safeguard the health and safety of their staff and themselves is not breaking any laws by refusing to provide a service or a product or goods to someone who is coming through from other area, from a higher, from an area with higher case rates. So, but don't take this as legal advice, because your situation may be unique. You may want to double check that with your legal counsel. But from our legal counsel, what we're telling businesses is that you're not breaking any laws by refusing service. We've communicated that as well, I think, to municipal leaders, I believe.
Yeah, this is Suzanne from the Quinte West Chamber, and I know that we've had quite a few of our businesses, especially those in the personal care sector, such as day salons, hairdressers, and some small retail shops that maybe don't have a lot of space within them, have made the decision not to serve people that are coming from red zones, and they've put it up on social media. Most of the community seems to be pretty understanding. I think they get a little bit of pushback every now and then from some people, but I think overall most people understand and support that position that some of those businesses are taking, especially those in close contact with their clients.
Yes, so we've heard that. And I should say, conversely, a business is not breaking any law by seeing someone from outside the area. So there's nothing in the regulations, apart from the recent announcement by the government related to driver's tests, people not being able to book elsewhere if they were booked in Toronto or Peel. There's nothing in the regulations that prevent travel, as far as we know. And we also get complaints about businesses catering to the GTA. So we've heard that some businesses are bringing people in to the area. We've looked into that, the odd complaints, and we haven't been able to substantiate that. So if that was happening, we would have a conversation with the business owner and explain, try to persuade the person maybe not to do it because it's not best practice, but we haven't seen any of that happening.
And I think that's probably, there's a sentiment in the community that's concerned that people are being attracted to the area. And we just need to make sure that that doesn't happen. And I know we're very careful about it with regard to some of our things with even our Discover Belleville outreach. So I do have a question about additional rules for a yellow zone, and I think this primarily relates to food and drinking or food and restaurant establishments. Is that correct?
Oh, sorry. I thought you were asking the person asking the question.
No, that's that I'm asking you if that's correct. Like, what are the additional rules for a yellow zone?
Yeah, sure. I thought the same as you. So there are in yellow zone. There's still places that are not allowed to open up. These places still have to remain closed. So buffet style food service, oxygen bars, steam rooms, saunas and bathhouses, amusement parks, water parks, nightclubs. The ones that are still allowed to open, like bars and restaurants, one of the major changes in yellow is that the premise has to be closed from 12 midnight to 5 a.m. Except for takeout, drive-through, or delivery, except dine-in for staff, and except to provide access to washrooms. In restaurants and as well with other premises that we'll talk about later, there is a requirement for a safety plan. So a food and drink business has to develop a safety plan, and there's a template on the ministry website that businesses can fill out, and they have 7 days from last Monday to create that. And if the member of the public asks to see it, they have to provide it. It's basically, if you go through the template, it's things that, business should be doing in the first place. You just have to put it down in writing to show the customer and give them a greater sense of confidence. And it's also a good re-anchoring for the business to see, what they're supposed to be doing in case they miss something. That safety plan applies to personal care facilities, premises like hair salons, tattoo shops. It applies to recreational places like the Quinte Wellness Center, A Good Life, all of those establishments, but it also applies to restaurants.
Is that the document you provided me last week on Friday?
I believe we did, yes.
Okay, I've posted that on our website and I sent it out to all our restaurant owners on Saturday morning, so I can make sure that we mention it again.
Yes, we can send it out if you need to receive it again. The other thing, just to finish off, food and drink establishments, bars, restaurants, and nightclubs. Music cannot be played at a decibel level that exceeds the level of which normal conversation is possible. Good question how we would enforce that. I have no idea at this point, but the idea behind that is if you play loud music, people are trying to talk while music is playing. They're more likely to shout, like the way I'm shouting at the phone right now. And that's not a good idea because, shouting, singing, there's a greater likelihood of you expelling droplets. The other requirement is no more than 6 people seated together. So if you have a group of 12 making a reservation, it has to be broken down into 2. And a change is that you must record the name of contact for every person who enters the indoor or outdoor patio, if there's a dining area. In green, it was just 1 person per party. In yellow, it's every person.
Perfect. Okay, and we've already seen that being implemented. Another question, office meetings under yellow, are they able to stay up to 50 people if there's enough spacing to keep physical distancing? That's an understanding someone's posted.
Yes, so workplaces, sort of behind the public area in the private workplace, the rules stay the same, provided you can social distance.
Okay,
so
that's good.
50, yeah.
And there is a question about the outbreak at P&G. Is it spreading within the plant? Did it spread by contact outside the plant? Has P&G identified protocols that were not adequate or not being followed? Are there lessons coming from this that other factories can learn from? I mean, there's a lot of questions around that, and I don't know if you have any insight that you can offer us at this point, or if it's still kind of too new a situation.
So when we got a positive case, and from speaking with the case, as soon as we get the lab report, or within hours of receiving a lab report, we identify where they worked, and we contact individuals in that workplace who are high-risk contact. And then if we get a second case and we can say that it's linked in the workplace, then we declare an outbreak. We also look for transmission outside of the workplace. So is the person sharing rides to and from work? Are they living with other people, or a case, someone who just became positive? So in terms of workplace contacts, our job then is to, once an outbreak is declared at any workplace, is to contact the Ministry of Labor, and we do a joint inspection of that workplace and provide recommendations to the employer as to how improve things and prevent further transmission. And then we monitor whether those things have been fixed. And if they are being fixed and there's no further transmission, then that's a positive sign. But if we have additional cases coming in, then we will consider additional measures, including up to closure of the premise or the plant or the workplace. So just to give you a generic answer without going into details about any one particular workplace. Did you want to add anything to that?
No, I was trying to say that obviously it's a lot of work from our end once these happen, which is why we focus on the establishments out there to obey the rules. Because once we start having a workplace outbreak and you're talking to contacts and then contacts with contacts, there's a lot of legwork to be done.
Yes.
Yeah, I can only imagine.
Following the rules is not going to guarantee 100% that there won't be a case associated with your business. However, it improves your chances and it saves you from having to deal with an outbreak situation. Because in some businesses, if we have a positive case and 6 high-risk contacts within that workplace, that may mean a shutdown of a particular component of the business, which could cost thousands and hundreds of thousands of dollars.
Understood. And I'll ask if that answers the question, just to say yay in the panelist spot. So there's a question here about expanding on the comment regarding hotel bookings, as most bookings would be from outside the region. So,
you know, we leave it up to the business owner and operator to decide whether they want to stop catering to individuals outside the region. And if you do, I don't think you're breaking any laws. However, we would obviously, you know, as winter is approaching, consider special allowances for anyone who's traveling through who might have a mechanical failure with their car, or if there's a snowstorm and they can't go any further. Conversely, if you continue to cater to people outside the region, you're not breaking any laws, but we would highly recommend that you are on your game in terms of doing all the preventative measures.
I think to that point, there is no way any hotel or motel wants to be the source of an outbreak, because it certainly will affect their staff if they haven't put in place the appropriate protocol. So I think we've already answered the question about the transition from green to yellow. For low risk contact, they just need to monitor their symptoms, correct?
Correct, yeah, and if they develop symptoms, we're asking them to get tested.
Right. Sorry, I don't know why that's crackling so badly. We have situations where a worker has a member of their household showing symptoms and are being tested, but do not have a contact with a, sorry, I'm just trying to get, but do not have contact with a confirmed case. The worker is told by HPEPH that they can continue to come to work prior to receiving the test results. Other workers do not feel that this worker should be coming to work until their family member has a negative result. What's the thought there?
Sorry, can you repeat that? You have a worker who has a family member, say a child or a husband who's symptomatic at home, who's waiting a test result or is not getting tested?
Is awaiting a test result. I would say that probably constitutes high risk.
So we follow the provincial guideline, and if you have a high-risk contact, someone who's been exposed to a case and then they become symptomatic, if the person is going for a test, we allow, the protocol allows the family members to continue on, provided they're not symptomatic also, until their test result comes back. If the person is not going to get a test, let's say they were exposed to the case and then 5 days later, which is usually the median, they become symptomatic, and they're going to write out the 14 days and don't want to get a test, then the family has to self-isolate. That's the provincial protocol.
Okay.
It tries to balance different considerations. If the test is within 24 hours, then the family member, provided they're not symptomatic, can continue to go to work. And the company, however, like the health unit here, or anyone else out there, if you're not comfortable with that, then you may exceed that as a business and provide time off for the employee. But the provincial protocol and what we follow is what I just articulated.
Yeah, I think this is going to be a tricky subject for the next few months, because we are entering into cold and flu season here in the Quinte region. And so, you know, if one family member has a symptom, it could be a cold symptom or not necessarily COVID, then asking another family member not to go to work, even though they have not been in known contact, I think is going to be difficult for a lot of employers to enforce that.
Yeah, and I think we use the same approach for schools as well. So if mom or dad were a close contact, high-risk contact of a case, mom or dad are getting a test, then the child can still go to school. But if they're not, then I think it's the same applies as I articulated before. The tests in our area, you know, we're getting the results pretty quickly, within 24 to 48 hours. And in some cases where there's an outbreak, a workplace outbreak, we will send a list down to the CAC, the assessment center, so that those individuals can be fast-tracked.
I was curious about whether people who were kind of identified as high-risk contacts would be fast-tracked that way. Great. Another question, if an employee is off for a day or two due to minor symptoms like sore throat, and then indicates they're symptom-free and able to return to work, is it advisable the employer insist the employee has a COVID test prior to the employee returning to work?
I think if the symptoms resolve and it's been 24 hours, then the person can return to work. But let me double check that one. That one gives me a little bit pause, but I think that's how we're dealing with that.
I did the same thing. I hesitated on that one.
Yeah. So if the person has sore throat and then became symptom-free, and they've been symptom-free for 24 hours, then I think they're okay to go back to work.
Can I just
Has anything changed?
Sorry, I just wanted to ask about the testing, because I know that there has been, it has varied over the last several weeks around who can be tested and who can't. And I know that there was a time in September where our testing centers locally were extremely busy, and people were being advised not to get tested if they were symptom-free. What is the current policy? Is it that anybody that wants to get tested can get tested at one of the testing centers in Quinte, or is it only for those who have been in contact or considered high risk?
I think it's, the government announced, and I forget when now, that asymptomatic testing was going to be done largely through pharmacies, and they've given us a list. It's on their website of who's participating. I think there is a pharmacy here in Belleville on Sydney Street who is one of the sites. The COVID assessment and testing center at Quinte High School and elsewhere at the arena in Quinte West is for symptomatic people or high-risk contacts of the case. And I don't think there's too much of a backlog. I haven't heard any complaints. There was a time where we were getting a lot of complaints, but not recently. And the complaints were mostly the turnaround for results. People were waiting 4 or 5 days to get the results. But that was months ago.
Okay, we have a lot. So Leslie, do you have a question?
Yeah, I just want to go back to the previous question before Suzanne jumped in there about how to manage staff and when they can return to work with small symptoms. One of the pieces of advice we've received from some of our businesses is to, like from our lawyer and insurance members, is to make sure you have policies and procedures in place for your business to reference. And as well to check with your insurance company and to check with your lawyer for your personal situation and how you manage that within your business from a legal standpoint and not just from a public health standpoint. So to have your policies updated for that. Would you agree with that?
Totally agree with that, 200%. That insurance has come up recently. In terms of where we are trying to get some individuals to high-risk contacts, we're trying to help them move away from their usual residence due to various factors, and hotels have been very helpful in that way, but we've been told by some of the hotels that according to their insurance policy, if the person becomes positive, that they can't stay there. So that creates a problem for us because we then have to help this person find another place to stay until they become symptom-free. But I totally agree with what you just said. Yes, Andrew?
I agree.
Okay, there was okay, workplaces that are closed to the public, and you and I have had this conversation many times. Masks are not mandatory provided staff are able to social distance at all times within the office. And just asking for some additional clarification on that.
Yes, so according to the regulations, if you are in an area that is not open to the public and you can distance greater than 6 feet, you are exempt from having to wear a face covering or a mask. Correct.
Banquet centers.
I was just going to say that you can still go, businesses can always go more extreme. Everyone in our office has a mask on. So even if we could stay 6 feet apart, the masks are still on.
Sure, fair enough. And that's certainly, think to your point about creating a safety policy. If that's the policy that you feel is going to keep your organization safest, then that's what you implement.
Agreed.
So another question about banquet centers. So my understanding, I mean, it didn't sound like anything happened with grouping requirements as long as capacity requirements or gatherings changed as long as you implemented the other controls in terms of contact tracing. Is that true?
Correct.
Okay,
so
if you had an event booked with 35 people because that's what the space could allow, you are still good to go.
Yeah. The gathering limits is a bit confusing because we have the 50/100, which is for businesses and organizations. That's still in place in yellow. But then you have the 10/25, which is like the backyard parties, the barbecues, impromptu gatherings in the park. That's 10 and 25. But if it's a business or an organization, nonprofit, who's renting out space, it's 50 and 100.
Right. So the organized events are different than your spontaneous events. Is that kind of the thing?
Yeah.
All right. Hopefully that answers that. Somebody wasn't sure if they missed your comment. And again, because the sound quality is a little tough here, how does the Ministry of Labor get involved in a workplace outbreak?
So the Ministry of Labor in this COVID pandemic, a lot of their work has been COVID related, to the point where maybe some of the routine inspections are being on pause. So we've been in frequent contact with them, and you know, they might see something on the news where they see there's an outbreak. They'll call us and find out if that's the case. But for health units under the workplace, there's a document that the ministry issued called Workplace Outbreaks. Once the medical officer of health declares an outbreak, we have to then reach out to the Ministry of Labor and let them know so that they're aware of it.
Is that a document you can share with me?
Yes, yeah, we can send it out. It's dated June, which you think might be outdated, but it's not.
Okay, that would be great because I can forward it to the people who are asking. Questions about wineries. They aren't traveling to Toronto any longer. Do we know where the Prince Edward County cases were transmitted?
I'd have to go through the list of all our cases. On our dashboard, there is a breakdown by region, but I'd have to dig in through and see where those cases were transmitted. If it was, Andrew and I are responsible for the workplace aspect. If it was related to a business, we would have heard about it. So I'm 80–90% sure that we haven't had anything related to a winery so far.
Okay, and can they continue with outdoor tastings?
Believe so, yes.
Okay, because we still are in yellow, so we don't have to do contact-free like purchases or payment. They're concerned that can they allow mass customers to come into the winery for purchases and or payment for orders, or do sales need to be contact-free? I don't think we're there yet, are we?
No, there is. So there is one section in the regulation dedicated to tours. So we can highlight that for you if they're doing tours within the winery. And what does it say?
It's 19.1. It's about tastings and tours for wineries, breweries, and distilleries. Trying to quickly speed read.
Yeah,
Sorry,
so
I'm not catching
allowed.
that, guys.
So in the regulations, there's an entire section dedicated to restaurants and bars, which wineries would sometimes fall under. But there's also a separate section dealing with tours of facilities and boat tours, and wineries providing tours of their production area and providing tastings would fall under that. And basically, it says you have to ensure that the group social distances.
And the main distinction is for that is they have to record the name and contact number information of at least one member of every party.
Yeah.
Okay. So, and as long as they are managing an indoor tasting the same way they were doing it in the green with full contact and no groups more than 6 at a table, they should be okay to do that, correct?
Yeah.
Okay. I think the biggest concern is that there's been a significant shift from green to yellow, but as you mentioned at the beginning, we're still in phase 3. So we still have, so there are some restrictions, but they aren't into phase 2 kind of restrictions where we were doing curbside.
Yeah. So, yeah, let me maybe just highlight some of what we think are significant changes. One is the safety plan.
Okay.
2 is people lining up outdoors outside a restaurant or retail establishment or congregating now have to wear a mask. So that's different. So if you're waiting to get into Value Village or Winners, or you're waiting to get into Montana's and there's a lineup, now there's a requirement that the operator must ensure all the persons are wearing a mask, even if they're distancing. And the other one is in some instances where the worker is coming within 6 feet of an unmasked customer and there's no barrier, they have to wear a medical mask and eye protection. So that's new and that's significant because that is, for example, when you have table service at a restaurant or bar, or if you are a hair salon and you're seeing people at the end of the shifts who have a mask exemption, then you have to upgrade from just a simple face covering to a medical mask and then a face shield if you're within 6 feet of that person. So that's significant. We're trying to get the word out to that, and the Ministry of Labor is trying to get the word out as well that this is new.
So 3-layer masks are and face shields required by service providers in close contact?
Anyone providing a service, if they're 6 feet away from an unmasked customer and there's no barrier between them.
Okay.
And that's significant. We're trying to educate operators, businesses. We put it into our mass communication through our inspection database, and we're hoping that as time goes on, that this is adhered to more and more.
And someone's asking to define that medical mask piece.
Great question. So it's medical or surgical. The medical ones are the ones that go loop behind your ears. The surgical one you tie behind your head. We would have to, I obviously do a case-by-case assessment. If we were faced with that situation, like if an operator is asking, is this a medical mask, we would have to look at the actual mask and then determine. There are some of the suppliers, like Cardinal Health, have different grades of masks. We're just looking for the level 1 mask, but we would have to look at that individually.
Okay, because there are but it would be safe to say that a homemade mask is probably not going to be compliant.
Correct. And that's why we're highlighting this as significant.
Okay. And a face covering that's a buff that just kind of slides up from your neck is probably not sufficient either.
Yeah, so a face covering like a buff or a cloth mask, that protects the person, it's source protection. It protects others from you, the person wearing it. The medical surgical mask protects the worker, incoming droplets from the customer. You're going to say?
So I was going to say, Jill, I think everyone was asked at some point to wear a mask, and then it went up to recently to the 3-ply mask. My understanding is this procedural medical surgical mask is a step up from that 3-ply.
Yeah.
So,
Okay.
so the business owner should be asking for medical procedural masks.
Okay. And that, again, isn't for me necessarily as a customer walking into the grocery store, but for someone at the grocery store who's going to be within 6 feet of me, who isn't protected by a plastic barrier. They have to have that medical 3-layer mask. They have to have a face shield.
Correct. So they're meeting the intent, which is personal protective equipment.
Right. Because yes, and that's a really good point, because through all this part, the only reason I wear anything over my mouth is really to protect you from getting my droplets. but it doesn't protect me from your droplets.
Correct.
Okay,
And
so
I think, you know, this change aligns things with the occupational health and safety regulations. The Ministry of Labor has been enforcing this throughout the summer, we've been told, and this change to the public health regulations, the COVID ones, just brings that up to the same level. So just to put it in context.
Yeah, so in some ways, nothing's really changed, because as an employer, you've always been responsible under the Occupational Health and Safety Act for protecting the health and safety of your workers. And now they've just deemed this is, you know, endangering the health and safety of the worker. So you're obligated by law to protect the worker.
Okay, and I think, yeah, sorry, I'm really sorry for the feedback.
No, it's okay.
There's a lot of questions.
So I was going to say, in instances like a convenience store or a grocery store where the cashier is behind a barrier, they wouldn't have to wear PPE. But in the case for like a table server, a restaurant where you know, they take the order, they bring the food, they clear the table, the customers are maskless. Then they would have to, the server, the employees have to wear PPE, and that includes the surgical medical mask and a face shield. Just so that, you know, if someone is going out there, that you can distinguish the differences.
So just for clarification then, so if the customer is wearing a mask, then nothing has really changed. The workers can wear just the regular mask that they have been wearing, or one of these 3-ply masks. But as soon as that customer is unmasked, whether they're sitting at a table in a restaurant or whether they've come into your business and they have a medical reason why they can't wear a mask, then your employee, if they're not behind a barrier, would need to wear a surgical mask and a face shield.
Yes, but the other thing is the customer would have to be within 6 feet of you.
Okay.
As well.
Oh, so if the customer is distanced from your employee, then you don't have to wear the face shield and the surgical mask. Just a regular mask would do.
Correct. So they're ramping things up the closer you are to the customer that's not masked and there's no barrier.
Okay. And just while we're on the topic of these different masks, I know one of the questions was around this 3-ply mask. This is just 3 layers of cloth that is now being recommended to replace some of those single layer cloth masks that people have been wearing?
Yeah, the 2 and 3 layer, you know, that discussion is around source control. Like Jill said, you're protecting the other person from your droplets. It doesn't rise to the same safety level as a surgical medical mask that protects both ways.
Okay, so should employers now be insisting that any of their employees coming into the workplace that need to have masks on, they need to be these 3-ply masks? Is that their obligation now? Not
under the provincial regulations. Like the provincial regulations that we're talking about here don't get that specific. It's a recommendation from the Chief Medical Officer of Health from Health Canada, but it hasn't been put into the regulations yet.
Okay.
But it is a good idea. It's a good idea that you go 3 layers.
Okay, so it's a recommendation, a federal recommendation, but it's not been made into any kind of regulation or law here in Ontario.
Correct.
Okay. Jill, you're on mute.
Sorry, my Alt-D doesn't work, and I'm just trying to have this large.
And I do have a question that's also maybe in the Q&A, and it was earlier on in your presentation, you mentioned that if somebody has been in contact with somebody, that you're mailing them letters, but you're not calling them. Is there a reason why you're not calling them? Because this question is saying sometimes the mail is a little unreliable. A phone call would be much faster.
So I should say we don't rely exclusively on regular mail. We'll email things out as well. Whatever's the best way to get to the person's hands. Like in the case of workplace outbreaks, we ask the employer to send out 2 letters, one to the high-risk pool, one to the low-risk, whichever way is fastest. If it means handing out the letters as people come in for their shift, or email, is whatever is the most efficient, effective way.
Okay. Quick other question. Is there a flow chart that identifies that measures or steps to be taken when someone is in contact or when an employee of family members is symptomatic that the employer can follow? So they have some kind of decision-making process. Might this be the outbreak document that you were talking about, a workplace outbreak that you were talking about? Would that provide some of that information?
Sorry, can you repeat that or expand on what you just said?
So I think an employer is looking for a flow chart that gives them some guidance about how they treat a worker that has identified symptoms or has come into contact with someone who has symptoms as well. So
we have fact sheets from Public Health Ontario on how to self-isolate properly, the do's and don'ts, and we send that to the high-risk contacts who are home isolating at home for 14 days. If someone is under isolation and they are not staying home and they show up for work, Public Health follows up on that and advises the person, you could be charged for coming into work when you're supposed to be self-isolating. If they leave the house for any reason other than essential purpose, they can be charged. So, if the workplace knows that someone is supposed to be under self-isolation, they can tell us and we'll follow up on that.
Okay, great. And the one other question was, can a business be more restrictive to people coming into work than the health unit is kind of declaring? So for example, you mentioned that if somebody has been in low risk contact or even waiting for a family member to get their test results but are asymptomatic, that they can continue to go to work. If that employee identifies to their employer that they're living in a household with someone who's being tested, can the employer ask that person to stay home?
Yes, provided the employer is not breaching any type of employment law and is properly treating the employee. If there are benefits that the person's supposed to be entitled to, and if the employer is not arbitrarily and discriminating against a particular subset of their workforce. So they can do that, provided they're not breaching any law and the Human Rights Code.
Right, and then the question is the employer required to pay COVID positive result staff while they self-isolate at home?
That depends on what the contract between the employer and employee is. What in the case of a union, there'd be a collectively bargained agreement. In the case of a non-union situation, there'd be an employment contract that usually gets signed when people start their job. The government, I think, has created a benefit for anybody who doesn't fall under those situations. So I think it's the CRB, not the CURB. It's a different one.
No.
And I can forward different, I can forward that information, I think, to you if you probably already have it though.
Yes, I was going to say there is something in place. So typically, especially if they're going to have to take 2 weeks off and you don't have an allowance for that kind of sick time, it's almost like an EI benefit that the employee applies for. So there are ways for people to be compensated while they're sick with COVID, but it doesn't necessarily fall on the employer's shoulders. Okay, safety protocols applying to outdoor events such as tented garden show, outdoor weddings. And I'm going to say we're right back to the 25 gathering outside, are we not?
Yes, if it's organized by a business and staffed by a business. Obviously, we go back to the 5 pillars. Well, first of all, outdoor is considered less risky than indoor. So that's our starting point, but still follow the usual precautionary measures, exclude people who are symptomatic, who have traveled outside the country, who have been in contact with a case, provide facilities for hand washing and sanitizing, social distance, all that stuff. I'm probably forgetting, I always forget the 5th pillar.
If you're not well, stay at home. If you're not unwell,
Yeah.
or if you're feeling unwell, stay at home. If you're sick, stay home.
If you're symptomatic, yeah.
And I think, so for example, we're even dealing with a funeral gathering on Saturday. So we are limited to 25 if we don't have staff present. If we're going to have more than 25, then we need to have funeral home staff present. So, and I think the point there is it needs to be an organized grouping if you're going to be more than 25 outside. If you're going to be inside, it has to be 10.
Well, yeah, I mean, it gets tricky, but if it's a funeral visitation organized by a funeral home, and then the 50, 100 apply. If it's a social gathering afterwards, where some people say, you want to go back to my place and we can reminisce about things, or the person who's passed away and that sort of thing, then it would be an impromptu, unorganized event. It would be 10 and 25. Right.
Again, so just to clarify I guess, from my perspective, it's that if it's an organized, staffed type of space that you're entering, the protocol are slightly different than a spontaneous gathering in my home.
Correct.
Okay.
It should also be noted that with funeral homes, they have a specific mandate from their college as well of how they practice. So the family can say and try to have what they want to happen, but the funeral homes do have rules and regulations coming down from above on them as well.
So I think, yes, I agree. I misspoke though on the funeral organized one. It's 30% of the rated capacity. I said 50, but it's 30%. So where that comes in is the operator would have to maybe contact the building department or the fire department and say, what are we normally rated for? If you're rated for 120, then you take 30% of that. So it's not a hard cap of 50. I apologize for that.
Yeah, and it's 30% of their space plus social distancing plus. So in some cases, if you can fit 100 and 30% is 30 people, if the square footage does not allow for 6-foot social distancing, then that number is further reduced from 30.
Yeah.
I have a little insight.
Yeah. Well, and that's it. There are a lot of complicated math protocol that come into play with this for sure. So somebody is asking if it's okay for a worker to wear a face shield without a mask, as long as they are covering below their chin while maintaining a 6-foot social distance.
So the regulation say that the mask has to be tight-fitting over the nose, mouth, and chin. But if they are sort of back of the house where there's no clientele, just other workers, and they can maintain 6 feet, then they're okay with the face mask. But if they are in the same car as another worker driving to a work site, or if they've come out from behind the scenes and they're talking to a customer, then the face shield that you described would not be enough.
Okay. And if you had to choose between a face shield or a mask, because you could only wear one, what would it be?
Great question. The shield typically protects the eyes more than the mouth and the nose, so I would go with the mask if it's covering the nose and the mouth.
I would agree.
And getting back to the whole point about why we wear masks and why we wear face shields, it's about protecting your stuff from coming out with the nose, mouth, and so it can't drip off your chin, so to speak. And then the shield protects your eyes and further protects you from other people, from you getting other people's stuff.
Yes, and I think, sorry, in that scenario, I think my answer was based on the fact that if you're referring to a medical or surgical mask, because we've talked about how the 2nd and 3-ply cloth masks are only source protect the other person. But if you're looking at protecting yourself and you're wondering, do I wear a surgical or medical mask versus a face shield, I would go with the mask, those blue ones that you see.
Okay,
the ones that
thanks.
Andrew and I are wearing.
Yeah. So the other question here, what's an inconclusive lab diagnosis?
Great question. I don't know if I can answer this one very well, but from what I hear, sometimes these come back and they have to be the sample has to be retested, run through or sent to a different lab. But something in the first test didn't come up the way it should. The way the PCR works is that it looks for 30 different pieces of the virus's genetic code, and maybe they didn't quite find 30, but they found some. So I would have to get back to you on that, though.
Yeah, that's my understanding too, that there's presence of the protein there, but maybe just not at the levels that they think would be cause enough for communicability. So it's indeterminate. There's something there, but they're just not sure if it's a level of concern.
What do you say?
Everyone catch that? All right, I think we've caught most everything. Oh, okay. What about staff with respiratory medical condition regarding masks while doing retail job? Like, are they not permitted to work?
Well, again, it goes back to, are they coming within 6 feet of the customer who's unmasked and there's no barrier? We haven't come up across that, but we've heard that the Ministry of Labor is telling the business that they have to reassign the worker, if that's the case. But if they're not serving a customer who's unmasked and they're just behind the scenes in the private workspace and they're maintaining the 2 meter, 6 feet distance from other workers, then they can be exempt under the regulation.
Okay. All right, and then, I mean, we have a number of sources for medical masks, but do you have anybody, do you have a recommended source?
There is a database.
Yeah, there's a link.
There's a link we can send you. It's a Government of Ontario PPE database where you can scroll down by different types of PPE, and then you can see what's available there. We'll send that out to you.
Okay, perfect. And I know that we can add it to our list as well. We have a number of local suppliers that we've added on our website at belleville-chamber.ca under COVID-19 tab. Do you know if there's a pharmacy in Prince Edward County that's testing for asymptomatic people, or is there another location in the county?
The only one I've heard about is on Sydney Street here in Belleville. I will look again at the government website, and I'll send you that link. It has a map with all the pharmacy locations.
Okay. All right. Well, you guys have done a great job. Really appreciate you being here today. I think we've caught all the questions.
There was one in there. I know that when the health unit brought in the regulation many months ago now about customers having to wear masks, it wasn't workplaces or commercial places could allow people to come in without a mask as long as they let them know that they were supposed to wear one. One of the questions is asking if the health unit could put the suggestion out there that if people aren't able to wear a mask, that they could at least wear a face shield going into a commercial building. Is that something you guys have thought about?
I can pass that on to our communications person. We keep frequently asked questions about masking on our website, and we can look at adding that to it.
Okay. Thank you.
And you know what, actually, Brett Forrestal had a question, so I'm going to give it to Phil and Brett. If they have any other questions or comments to make here, please jump in.
Sorry, but that had on mute. So my question was outdoor events. Do they include in an unenclosed tent?
It depends on the purpose of the event. There is language about in the bars and restaurants section as to what constitutes indoors and what constitutes outdoors. So if it's a special event that includes dining in, then we can look at that section. If it's something else, we'd have to look at the individual setup and maybe take guidance from the restaurant section, but we'd have to base that on case by case.
Let's say it was a private outdoor gathering on a private residence or private property with the limits of outdoor being 25 people. Would that be the limit in an unenclosed tent on a private event?
Possibly, if all the sides of the tent are not, if they're open to the air. But those situations, we've talked about what's in the regulations, but when it comes to enforcement, we defer those to the police and bylaw. So we haven't come across too many where we actually followed up on, unless they're towards the north part of our catchment area. But I would say it depends on the tent itself. Is there something there that you're seeing?
Talk about enclosing two sides. Yeah, nothing really that. So.
And I think probably the other piece that's really important to understand, and maybe you can confirm, but you don't generally go and look at people just for fun. You've often received a complaint, and that's what really generates the inspection or the review.
Correct. We definitely respond to complaints, and we're not actively, or we have not actively been going out doing, I guess what I'd call enforcement blitzes. We're not trying to generate ticket money here. Having said that, having been dealing with the workplace outbreaks right now and the incredible demands it puts on health units in terms of staff resources, there probably will be a bit more of a push on this, on these new requirements, particularly what we've been talking about, the personal protective equipment, that they have the safety plan in place. You know, we'll always focus on the education component, but there definitely will be an increase in the enforcement aspect, because we just can't continue on the path that's going right now. So we've been given direction to increase the enforcement if we need to.
Yeah, there's certain things that we haven't stopped altogether. So if there's a need to send rabies vaccine from our office to a doctor's office, we will do that. Obviously, that's an essential service. If there's an adverse water, a bad test result somewhere at a water system, we will follow up with that. We have as well done proactive blitzes of nursing home kitchens and schools when they opened up. But the rest of the work is all complaint. And right now our staff are answering complaints. We've had like 3,000 complaints this year, whereas last year at this point, we were, I think, half of that. And some of them are multiple complaints on the same business that we've already dealt with, and we just won't, we'll just tell the complainant that we've already addressed this. But right now, as Andrew said, you know, we have direction from our higher ups to go out and be more proactive in checking these new PPE requirements, but our staff are largely, our inspection staff, a good chunk of them are involved in contact tracing. They've been trained to do that, and they're following up on cases and contacts. So it's a work in progress, as Andrew said.
Thanks. And Phil, anything from you in Quinte West?
I don't think so, not specifically. It's very good discussion, very interesting to hear all these different questions and comments though.
And I think what I hear the most is that no business owner wants to be at the root of an outbreak or transmission, but they also want they want to be compliant, but understanding some of the regulations because they're changing all the time has been a challenge. So I can't thank you enough for coming here today. It's been very helpful. I'm thankful that you reached out, and we've got our compatriots in Quinte West and Prince Edward County now joining us too, so that's fantastic. For all 60 people that joined us today, thank you as well. And I think we're probably done. I don't see anything else. The recording will be made available. You're going to forward me a few bits of information as well that we'll send out to each of our chamber people so they can send it to the people that registered. Any other thoughts?
Jill, I just wanted to mention quickly that there was a lot of questions today about employers asking employees to stay home. We did share the link to that federal sickness benefit. And so it is important, you know, like you said, that employers don't want to be responsible for an outbreak. If they want to put rules in place, there is a federal fund there to pay those employees while they're off. So like, don't take any chances, right? Like, let's keep everybody safe.
So back to you there, Roberto and Andrew, thank you so much.
And just as concluding thoughts, again, you know, it sounds cliche, but we're all in this together, and if we work together towards the same goal, which is to prevent further transmission, I think we're going to be better off. And just to highlight as well, if you know someone who's positive or heard of someone who's positive, to show compassion and not blame that person for acquiring the illness, because sometimes it's they followed all the rules and regulations and they still contracted the virus. So we've seen a couple instances of that, of bullying and so on, and we as an organization don't stand for that.
Perfect. All right, that's great. So I think we're good. Anything from you, Leslie?
It's always the worst when you can't see your cursor on the screen because you're already touching it. I just further thanks to everybody for attending today, and thanks to Roberto and Andrew for joining us and sharing this information. and to my partners, Suzanne and Jill, for doing this. And of course, Lisa, for the administration. I think this is great, and maybe something we should continue to do a little more frequently with each stage here. Thanks, everybody.
And from Roberto and myself, thank you, everyone. Much appreciated. And remember, you don't want to see us. We really don't look that good.
Well, we might be able to hear you better, because that will be the one challenge I'm probably hearing.
Yeah, we're gonna have to figure out next time. Maybe we need to come down and use your technology instead of ours, because there's got to be a better way to do it.
Yes, well, certainly. And I can socially distance upstairs in the log cabin. You're welcome to come up there. We'll set up a camera for you. You're good to go.
Perfect.
All right. Thanks, everyone, for joining us. We'll talk again soon.